Hi, I'm Dr. Ramsey Shoker, a plastic surgeon, board-certified plastic surgeon in Dallas, Texas. And this is the first in a series on questions that I often receive about facelift. So I thought I'd start with the first question that often is asked is, well, how long does it take to do a facelift? And well, the first thing you have to do is define the facelift. And I tell all patients that, the term facelift has many connotations to many people. So you have to define what the facelift that you might be getting actually is. So the first thing we decide is, what facelift are we talking about? The most common procedure for me is a lower face and neck lift that basically makes the face look as good as possible, as long as possible with what we do, from here to here. That's what the facelift really does. It improves everything from here to here. So that's the definition of what the facelift is, and really the definition of what a facelift does is where it provides the improvement. So we kind of define that first. And that's the most common procedure because most people age like that. They have aging in the jowl, the lower face, and the neck. So those are the areas we address. If they want improvement of the area around the eye or the brow, then that's really not, quote, part of a facelift, but some surgeons do include it as part of a facelift. So you have to first just be sure that you define what you're doing. So then once we define we're doing a lower face and neck lift, the patients always ask, well, how long is it going to take? Well, I say it takes about 5 hours, and they look at me with somewhat of astonishment going, why does it take that long? I saw 2 other surgeons, and they said it'd take 2 hours or 2.5 hours or whatever. Well, you have to define what you're doing. So I break it down and I say, look, this is what we're doing. First of all, we're not doing just a skin lift. We're also doing the deep muscle here and here. So you have a internal architecture that's as tight as it can be and as youthful as it can be, and then you gently redrape the skin over that architecture. And of course the direction of pull may take longer if you're doing it in a more precise way, meaning up here and back here, so there's no distortion of the mouth, so the pull is up here and back here. So once you've defined those, you break it down and say, okay, here's how it works. You come into the operating room and technically the time for the facelift starts. It may take 30 minutes to get you settled with the monitors and have the anesthesiologist or whoever's doing the anesthesia get you settled and give you anesthesia to relax you or put you under a light general. Well, now we're 30 minutes into it at least. By the time we make sure you're in a proper position, we warm you with a warming blanket, and then we start prepping and getting your face ready for the surgery. If you need something like an additional treatment like a fat injection, that may be done first, but let's just stick with a lower face and neck lift. So we're 30 minutes into it, we've prepped and draped your face, and then we start. Usually we start by putting local anesthetic in your neck and making a small incision here to prepare the neck by releasing the skin from the neck muscles and then tightening the muscles and usually releasing the muscles so the bands will go away and stitching the muscles in the midline. That's another 45 minutes or an hour. So we're already about 2 hours into it, give or take. Then we make the incisions that are hidden at the edge of the sideburn, inside the ear, in the crease, and usually down the hairline, because that's the only way you can redrape the skin and make it look natural yet provide a long-lasting result. Well, that incision and lifting the skin takes about 30 minutes, and it takes an additional 20 or 30 minutes to do the deep muscle work in the neck, in the face and the neck, so that you've created a nice sling of muscle and here up to here to make sure that internal architecture is as tight as it can be. So that's another 45 minutes or an hour here, and then you do the other side. So now we're at least 3.5 hours into it. And again, this varies depending on the patient's size and different anatomy that's different. Then once we've done that, we make sure everything's as clean as possible as far as no bleeding, and then we start closing. Well, it takes about an hour or 45 minutes to trim the skin precisely and stitch the skin perfectly. You could staple it in 10 minutes, but obviously no one's going to do that. And we do say that to patients. They said, oh no, please don't staple it. Well, obviously we would never do that, but it takes time, and the 5 hours is primarily all detail work. There's very little blood loss with most facelifts. And of course, as a surgeon doing it himself, there's no one else sewing. You're there for my expertise, so certainly no one else on my team will be putting stitches in. I like to say you can blame me for every stitch and you can give me credit for every stitch because I'll put it in. So, and then it takes about 15 minutes to put a dressing on and wake you up. So I think you can kind of see that if you're doing a facelift that is long-lasting with great detail, it simply takes time. I like to say you can't compare apples to avocados. You have to make sure the kind of facelift you're having includes all the details that I mentioned. Otherwise, comparing the times is somewhat irrelevant. So anyway, I hope that helps you. If you have further questions, you can always call our office.